Hi guys, and thank you for joining me. Today we are going to talk about Crohn's treatment. And the first treatment we're going to talk about is corticosteroids. And it is referred to between us Crohn's patients as steroids, but it's actually called corticosteroids. And what corticosteroids are is a synthetic pill that mimics the adrenaline gland. But before we get into that too much, if you haven't checked out my other videos on what Crohn's disease is, I'm going to post a link right now to that, and you can follow that link and check that out. So now, if we get back on topic here, corticosteroids, what it does is it suppresses the inflammation and the immune system. It's a potent little pill for inflammation, and which is great for us with Crohn's disease. It's a lifesaver. It becomes a lifesaver for us because it's really, really potent when it comes to inflammation. And inflammation is what Crohn's disease is the immune system creating inflammation in the body. Long-term use of corticosteroids has a lot of issues. They are great for short-term use. Long-term, not so great because you fall into side effects. I got a little too far there ahead. But again, if we go back a little bit, the common ones of corticosteroid, the common names used for them is prednisone, which is a brand, methylprednisone, and budesonide. And these are synthetic corticosteroids, meaning man-made, mimicking the action of the cortisol, that natural corticosteroid in the body made by the adrenaline gland. Corticosteroids have many effects on the body. They are also known for their powerful anti-inflammatory properties, which is great for Crohn's disease and other immune disorders since it suppresses the immune system. I'm reading off a little bit because this is big. Corticosteroids should always be tapered off. Always, always, always. I cannot stress that enough. You will go into withdrawals. Your adrenaline gland needs to catch back up. You cannot just stop corticosteroids or steroids flat or cold turkey. You need to taper off. I cannot stress that enough. Side effects of not tapering off or tapering off too fast would mean nausea, weakness, decreased appetite, abdominal pain, vomiting, fatigue, weight loss, diarrhea, and shock. Seriously, you can go into shock. Corticosteroid side effects, and I have gone through a majority of these. I would like to stress that these are a majority of these side effects. Yes, you will get some of these side effects, but the majority and the bad ones or the severity of the side effect goes up with the bigger doses and the longer you are on them. Let's keep in mind that I was on steroids for almost a year at one point. So yes, I went through a lot of side effects. The side effects are high blood pressure, loss of potassium, headaches, acne, thinning of the skin, insomnia, vomiting, easy bruising, impaired wound healing, vision change, loss of bone density, glaucoma, weight gain, sodium retention, restlessness, growth of facial hair, rounding of the upper back, mood changes, liver issues, and euphoria. And again, please remember that the majority of these are from long-term use. Well, that's the end of that. So with my experience with steroids, it's hard. Like, I've become steroid dependent on these things. So when I go on them, I need something else to get off of them. So I am on biological medications, which is another video, but yeah, these are great little pills. They're potent. Lots of side effects if you're on it long-term use or on high doses for too long. Don't forget to like, comment, and subscribe. Have a great day.